Thank you for joining us for this episode of This is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today I'll be sharing a recent initiative that we've been working on called the AARP Age-Friendly Social Innovation Challenge. This is a 10-part special series, and today we're going to be talking about Part 7, Lifelong Learning. So this series is related to several regional events that we've hosted through the George Washington University Center for Aging, Health, and Humanities with our 5 regional age-friendly municipalities and our multiple partners. So if you missed the overview, please check out Part 1, which is episode 89, if you're looking for it on my website, melissabphd.com, or you can find it on my YouTube channel. In a nutshell, the morning sessions were spent learning about design thinking, and then participants were paired by domains of interest. These domains are reflective of the World Health Organization and AARP's framework for age-friendly cities and communities. And as I said earlier, this episode is focused on lifelong learning. Lifelong learning, simply put, involves being intentional about learning new things, no matter how old you are. Participation in cultural and recreational activities are important for both our health and the quality of life in our communities as we age. Older adults are the most generous patrons of the arts programs, and they increasingly participate in lifelong learning programs and bring a lifetime of experiences to intergenerational programs. And I love that even my kids are now involved in this because they find things on social media about older adults continuing to learn new things like ice skating. So my son sent me a link to a video of a 77-year-old who learned to ice skate. So there's nothing wrong with learning new physical skills as well as intellectual ones. Both types of lifelong learning are beneficial. So there are many issues related to lifelong learning for older adults. And in order to focus the group's thinking and problem solving, a scenario was designed by our design thinking team. From there, the group devised different ideas about what the problems were to define it, and then they chose one to create an innovative solution for. The participants included university students from the DC metropolitan area, older adults, and local leaders who live in the region and work in the age-friendly space. And groups were free to come up with ideas based on what they felt like was the biggest priority for the subject of their scenario. And they were instructed to think about solutions without concern for practicality, financing, or policies that would need to change in order to make the solution a reality. Now, as you listen, you may have an idea for a solution, or you may know of a program that would help older adults and their families facing a similar challenge. Please add your comments below this video, and we'd love to hear from you. So let's listen in now to hear what they came up with.
We are talking about our friend Julio, and Julio is 55 years old. He lives in Hyattsville, Maryland, with his wife and 3 children and their dog Fluffy. He's worked at as a hospice nurse for 9 years now. He loves his work, but is feeling stuck and burned out. The pay isn't great, and he has to work about 70 hours a week to make ends meet. I would love to see less patients and learn to be a manager, but sometimes I think I would have a better chance in IT, he says. I'm thinking of leaving healthcare altogether and enrolling in a technical community college. So we had a great conversation about Julio and some different solutions for him, and realizing that he has a problem, but it is a bigger problem for both the organization and for society. Julio needs a way to increase both his income and job satisfaction and find some work-life balance because he's really burned out and unhappy. Working 70 hours a week would lead to both burnout and unhappiness. This problem is a result of the employer's lack of attention, support, and employee development programs designed to help care workers thrive and grow within the healthcare industry. So he's really been stagnant, doing the same job for 9 years. And he's working 70 hours a week because he needs to care for his family. So it's certainly a challenge for him. So some solutions that we developed. We believe there must be some nonprofit or public resources that can provide low cost or free career counseling or training services for mid-career workers like Julio, and that 55 plus cohort. And the services he needs both include how to advocate with his employer, and as well as look at what kind of continuing education may be undertaken. It's not clear whether Julio really should leave his job or try to make the job at the hospice work for him, where he could either increase his pay by doing some self-advocacy, or have the hospice program provide him training so he could stay there and expand his skills. So with that coaching and support, Julio's employer could work to create pathways within their organization for upward mobility, including the training, mentoring, job exploration, and higher pay. And it's potential that an organization could work with perhaps their local community college. And it's possible that the organization has an EAP program that could be pursued. We also talked about how the caregiver industry is really struggling with employee retention and burnout, and the concept of unionizing or organizing workers in this industry to achieve fairer working conditions, including higher pay, fewer hours, support on the job, and opportunity for promotion. All of those should be considered.
I would like to thank all the participants in this group for their time, effort, and energy. Again, I think the solutions identified from this group go back to identifying and raising awareness about nonprofit or public resources that offer career counseling or training services. The challenges that Julio faced could also potentially be made better if you worked for an age-friendly employer. And if you haven't heard of that program, you can check out episode 58 with Tim Driver, who's the founder and CEO of Age Friendly Ventures. And another option for retooling would be finding an age-friendly university. And if you haven't heard of this initiative, please check out my interview with Dr. Joanne Montepar, which is in episode 55 on my website. If you have any other ideas for a solution or know of a program that would help older adults and their families facing similar challenges, please add your comments below this video, or you can post them on my website, where this episode can also be found at melissabphd.com. I look forward to hearing from you. Thank you for joining us for this episode of This is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities.